Hey guys, it's Megan here from People Medical Consulting, and I want to do a deep dive today into the Medicare billing rates. So this is going to be an incredibly simple overview. I don't want to go super in depth into them because let's be honest, the MBS is kind of confusing, but I want to give you an idea of the A1, the A7, and the A2 Medicare rates, who's eligible for what and where you have to be. So the A1 Medicare rate is the VR rate. So that is 100% of the item number, no questions asked. So if you've completed your fellowship exam, you're eligible to bill the A1 Medicare rate. If you are a non-VR, you can access the A1 rate by being on one of the 5 fellowship training programs. So those include the AGPT program, the Acronym Independent Pathway, RGTS, VTS, and PEP, which is now going to be known as FSP. So the A7 Medicare rate is for those doctors working in a regional area that is a M2 or higher who aren't on one of those programs or who aren't VR. So you're going to be billing that A7 Medicare rate if you're working under MDRAP, or if you're not on any program, if you haven't chosen a fellowship training pathway, you're on a visa, and so you're working in a M2 or higher, you'll bill that A7 rate. So the difference between A1 and A7 is 20%. So instead of billing 100% of that Medicare rebate, which, $40, for example, you would bill 20% less than that. And that's what you would be eligible to bill. In our blog, we actually have examples. So jump in and have a look at our blog if you want the actual maths. I'm a solid English person, not a maths person. So the A2 Medicare rate is the last one that I want to talk about. So there's a lot of doctors who are non-VRs working in a CBD location at the moment. They managed to get in and get grandfathered before the health workforce legislation came in, and for various other reasons. So the A2 rate is very different from the other two rates in that it's 40% less than that rate. So if you're working in a M1 location as a non-VR doctor, you will be billing 40% less than what someone in a regional area on a program would be billing. So as I said, for the maths, jump in and have a look. But if you think about it on a tiered system, so 100% of billings, 80% of the VR rate, and then 60% of the VR rate. And that is your A1, A7, and then your A2. I hope this video has helped clarify. And if you've got any questions, please send them through. Check out our blog in our bio and send through any other questions you might have. Have a great week.